Well, safety, it works rather well, and it's a really good question. Safety always is first. It has to be. So if someone's escalating to violent behavior and you normally need to do some kind of, getting other people away or getting that person safe, or I don't like restraint, but if that's something that you guys do that needs to be done, whatever needs to happen next to keep that person from harming themselves and other people is what needs to happen. I think the way that we do that from a trauma responsive perspective is, number one, to understand that what we are seeing is likely based in fear. This is true for all violence, right? I am afraid that this other person's trying to hurt me, or that I'm not going to get what I want, or I'm triggered into a previous situation. It almost doesn't matter at that point. What we know is that when animals are violent, it is based out of fear. And so while we are taking whatever steps we need to take, we need to be working to help them feel safe and not scared. It's pretty straightforward. So I know this can sound ironic, but a colleague of mine created something that she calls the safety script, and I actually talk about this a little bit in my book. It very much reproduces a lot of what we've talked about here. But for example, let's say that I am trying my best to punch someone else in the face. I'm violent, I'm dangerous. You need to stop me from doing that. So if you need to, again, whatever you guys normally do, put hands on me and move me away, or ideally you don't put hands on me, but you get everybody else out of the way, or whatever it is, you're still talking to me knowing that I'm afraid. So you might be saying, Lara, it's okay. It's okay. You're safe. We're not going to let anyone hurt you. Now that sounds really weird when I'm the person busy trying to hurt other people, right? But if you appeal to my empathy, don't hit Kevin, that would hurt him. Or if you don't stop it, you're going to lose your privileges, or whatever. We're going to call the police. Remember, if my alarm system has gone off, then that thinking part of my brain that can go, oh, I don't want the police, or, oh, I don't want to lose my privileges, or whatever it is, not connected, can't join the conversation the way you want it to. You have to help me feel safe first. So if that's, I can't put my hands on you because you will freak out more, but I am going to kind of gently try to corral you away from what's going on, or I'm going to make sure not to block you if you're trying to get away from me. I will say this is not always true, but in my experience, people often will tell you what they need, right? So when I worked with teenagers, it was common that a kid would say something like, back off or I'm going to hit you. And when staff didn't listen, guess what happened? They got hit. And my rule is always, I don't get hit in the face. Everything else happens from that. So if somebody tells me back up or I'm going to hit you, my answer is always, thank you for letting me know. I will back up. Is this enough? I can back up more. It doesn't mean I'm going to let them harm themselves or harm anyone else. It just means when you're telling me what you need, I'm going to try to listen to that. And I know that sounds really obvious, but it's amazing how often people don't do that. So anyway, I'm going to listen to what they're saying if they're able to tell me anything. And I'm going to keep talking to them to try to connect with them, to help that amygdala say, am I safe right now? Yes. Or at least I'm getting there, right? So I don't escalate with them. And this takes us right back to the CALMER skills, right? Even if they're doing something that's kind of freaky, I need to do what I need to do to get relatively calm and grounded. And then as I'm talking to them, you're safe. It's okay. I'm not going to let anyone hurt you. They start to feel safe. And again, this varies from individual to individual, but whatever it is for them, whatever helps them feel my presence and feel that I'm connected to them, right? So I'm going to make Kevin my person here. Kevin, it's okay. I'm not going to let anyone hurt you. I'm here. We'll work this out. This is going to be okay. Tell me what you need, right? They begin to feel connected. It's not waving a magic wand. It might take a while and they may still be escalated for some time, but you can almost see people start to come down a little, right? And then we can start engaging the brain. We can start helping them to make choices. So it might be, of course, this helps if you've already had some of this already in place. But let's say that Kevin, in this case, Kevin's our individual. He's escalating into violent behavior. I'm helping him to feel safe. I'm helping to connect with him. And now I'm going to start giving him very, very simple choices. Not, what do you think will happen if you do this? You'll get fired, blah, blah, blah. That's way, way, way too much, right? But I might say, do you want to stay in here or should we go outside? Do you want to take your shoes off? Maybe we've already worked on a range of things that he feels calming, right? Ideally, we've done that. But even if I've just met him, I can talk about, do you want me to stay close? Do you want me to back up? Should we sit down? Right? Whatever. My colleague talks about giving people something like a deck of cards and having them sort them. Now, some of your individuals will have things they already like to kind of go through to calm themselves. People on the autism spectrum often have that. So if they already have something like, I need time to go to my room and sort through my baseball cards, great. But it might be something you can also introduce. So for example, and I know I'm going into a lot of detail here, but one way to gradually get the thinking brain back online is to make simple distinctions, like you hand me a deck of cards. I guess I'm handing Kevin, I hand Kevin the deck of cards. Can't remember who my individual is here. And I ask him to sort them into red and black. Boop, 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 boop. Maybe with one hand, if I have that coordination, because it crosses the midline. Crossing the midline in the brain helps regulate the brain and get it back online. That's an OT trick. If I have any OTs, you guys probably know what I'm talking about. But anyway, red, black, red, black, red, black. It takes a minute. Oftentimes we just need time along with everything else. So I get everything sorted. And then you ask me to sort it by suit, right? Diamonds, hearts, spades, and clubs. I still don't need to read or write or have, I don't need to be enumerate. I don't need any of that. I can still sort them into piles. If I can, if I know numbers, then maybe after that, I sort each one in order, ace through, whatever. You can see this. And this is just an example of a really, really simple task for my brain that gradually gets a little bit more complicated. This slowly brings my thinking brain back online while you've been working to help me feel safe and connected. And now maybe we can talk about what happened. Maybe my language is back, or now we can make some choices. Kevin, do you want to come over with me to Troy and apologize? Do we need to talk to your boss to make blah, 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 blah. Now we can move into problem solving. But initially, safety is always first. It's very, very challenging, and it takes a long, long time for some of our individuals to feel safer with us. And even then, there may be still times that they go off, that they get triggered, we don't know why, or something happened that we did not see with another individual, we only see the reaction. So none of this is a magical transformation, but I do believe that, as I said before, the fact that the brain changes with experience is that's the engine for the damage that trauma causes, right? The more we ask the brain to do something, the better it gets, including fear and reactivity. But the more times they get triggered, they go off, whatever, and they're not met with punishment or anger or isolating or shaming, and they are met with patience and kindness, and help recognizing that they need to feel safe, recognizing what they need, not just what they're inflicting on everyone else, the brain has an opportunity to change in a different way. So we'll come back to that, but that is my answer to you. And there are times when nothing works very much and you just get through it, to be honest with you. But I think we always position ourselves with safe, connected, and in control. That gives you and that individual the best chance at regulating them more quickly than anything else. Okay, great question. Moving on. These next two are really kind of add-ons that may fit in the moment, or they may be later. So once we've gone through, and I need to come back to my slides too. So let me share the screen. Okay, so I think you guys can see the slides now. So we come back to the last two, express. This just means now I'm ready to express what's going on with me, right? It might be that I needed just a few seconds to get myself grounded through checking in, accepting whatever the answer is, trying to be lovingly kind to myself, and then being mindful about what is and isn't actually happening. And then I can do some problem solving or talk with somebody about what I need in that moment or whatever it is. Now, this also relates to afterwards. Many of us in the helping professions, and this is true across the board, many of us are, we play multiple roles, right? So we're a professional, we're a staff person, we're a whatever, and we are a parent and we have kids, or we are the child of aging parents, or we are parents who have become licensed to be staff people. You know what I mean? Like, many of us wear many, many hats. And a lot of us don't have a lot of places where we can let go of and talk about what happened for us in that experience. So if I can go back to that question, when someone escalates quickly and gets violent, doing the calmer skills, let's say, doesn't mean I don't have feelings about it. Maybe it was scary for me or triggering for me. I have a coworker who I just really, really love. And he once said, I don't know what it is about me, but I have a really hard time staying calm and grounded when someone bites me in the face. Yeah, same, man. If someone bites me in the face, I'm going to be pretty upset, right? So we're human. And using the calmer skills is not to somehow magically make feelings go away. It's a way to work with them and to stay present and grounded even while we're having them. But that doesn't mean we don't need to do something with them later. So if that's a partner or a roommate or a friend that you talk with afterwards, get this, or a supportive colleague or supervisor, there's got to be a place for this stuff. And even if it's something where you do this for yourself, like journaling, I would say that if you are hearing this and you know that you don't have that in your life to the extent that you need it, if there's one thing you take away from this training and turn into an action, I would want it to be that. Whether that's working with a therapist or a clergy person or someone in your life, whatever it is, having a place, a safe place where those feelings and reactions can go and you get what you need and you get fed by that. I think that's really, really important. So again, express might be in the moment. Now I'm ready to take charge and step in and talk to people and problem solve, or it might be after the event just for yourself. And connected with that is respond, right? Now you're ready to take some action. So you can imagine in a situation that's happening very quickly, this whole process might be a couple of seconds, or this might be hours. Responding might be you get through the situation, you express your feelings and get the support that you need afterward, you think about it, and now you're going to go talk to a supervisor, or you're going to bring this to a team meeting. This is how this went down. This is what I think we need to do. This is what I need, blah, 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 blah. So all of these things really are just little steps to take us from reacting, whether that's going into our red zone or our blue zone, right? We're freaking out or we're checked out, to being it doesn't have to be perfect, right? But relatively grounded and calm and present. And that is what the individual can use to gradually modulate down with us. It may take seconds or moments or hours, but I promise you, if we are activated and we are out of our window of tolerance, it is much, much harder for us to get that other person to do it. We have to be there first. So as we move on with this, I think I want to wrap this up with giving you guys another strategy to work with this. So you'll remember that I asked you before the break to check in with yourself at some point, going from the bottom up. What are your, I think I'm going to go backwards a little bit to the previous slide here. There we go. Checking in. What are your sensations in your body? I feel loosey-goosey and relaxed. I feel tense. I feel numb. I feel checked out. What are your emotions? I'm happy. I'm sad. I'm scared. I'm worried. I'm embarrassed. I'm angry. And what are your thoughts right now? So I want you to go back to that experience and think about what it felt like to reflect on those things. Was it okay with you? If you didn't have much going on at that moment, then probably that was fairly simple. If you were stressed about work, or you just got a phone call, or I don't know, something else is going on with you, then you may have had a lot of sensations and feelings and thoughts. Sometimes whatever is going on can be happening so quickly that we need a minute to even kind of click into being able to do that reflecting. And so I'm going to teach you guys a breathing strategy. This helps all the way through the process, to be honest with you. So if you check in with yourself and you notice that you're triggered yourself, or you're angry or scared or whatever, this can be helpful as a grounding strategy. And it also, if you're having trouble checking in because everything is all jumbled up, this can be something good to start with. And then you can move into check in, accept, lovingly, kind, mindful, respond, and express and respond. So I'm going to explain this a little bit, and then I'm going to invite you to do this with me. It is absolutely voluntary. So if for any reason you don't want to do this, that is completely okay. And you will all be pleased to know that you can do this without getting up from your chair. Ever since I've been in my 50s, I've come to deeply appreciate sitting down. So you don't have to get up, you don't need a partner, none of that stuff. What I do want you to do is, if you're going to do this with me, go ahead and get rid of any distractions. So again, if you've been kind of secretly checking your phone or whatever, turn that over. If you've been taking notes, put that aside a little bit. You are welcome to close your eyes if that feels safe, but you don't have to. If you don't want to close your eyes, you can just sort of lower your gaze. And I like to look at something kind of boring. So you might clear things out of your immediate vision and then just look at the tabletop or where the wall meets the ceiling, whatever's comfortable for you, it doesn't matter. And it's nice to do this if we can let breath move in and out of our bodies. So if it's comfortable for you, you might have your feet flat on the floor. Now, if you are a petite American, such as myself, and your feet don't touch or that's uncomfortable, don't worry about it. I like sitting so that I'm upright. So again, the breath can move in and out without, if we're slumped over or curled in, it's actually a little harder to get the oxygen in. So you might want your core to be awake, but you don't want to be straining. So if you need to lean back on your chair, that's fine. Just have your core a little bit awake. So your feet are planted, breath can move in and out of your body. Your eyes may or may not be closed. We're good. Now, here's what I'm going to do with you. I'm going to have you just breathe, just however you want to. There's no special way. But when you breathe out on that exhale, you are going to say something to yourself in your head. And what you're going to say is a phrase, and it's just for you. You don't have to tell anybody what it is. You're going to be saying it in your head. You won't be saying it out loud. Now, this phrase should have two components, okay, two elements. One is it should be something meaningful to you, something that you find calming or grounding or inspiring. So a lot of times people will pick something from their favorite prayer or a poem or a song lyric, something that's deeply meaningful to you, okay? And it needs to be short enough that if you were saying it out loud, you could say it in one out breath. So the Lord's Prayer might be your favorite prayer, but if you try to say all of that on one out breath, you are going to pass out. So it might be a portion of that. It might be something like, Our Father who art in heaven, or Allah Akbar, or Shema Yisrael, or let it be, whatever, it doesn't matter. So meaningful to you, short enough for one exhale. Many of you, because I know I have a lot of high achieving people in this audience, may be experiencing what I like to describe as phrase anxiety. Is there a phrase that's more meaningful for me? Is this the best one? Don't worry about that. If you like this practice and you decide to incorporate this for yourself in your daily life and you find a phrase you like better, that works better, fine. But for right now, just think about something that you want to use. I'll go ahead and take a sip of tea while you're doing that. Okay, so I'm going to do this with you and then we're going to talk about it a little bit more. Here's what we're going to do. When I tell you to begin, and I will use my phone to kind of track the time here. When I tell you to begin, you're just going to breathe and say your phrase on your exhale. Now, when we do this for a little while, we'll do this for about a minute to 2 minutes, you will get distracted. You will have a thought, you'll have a feeling, your stomach will growl or whatever. That's just how our brains and bodies work, okay? It doesn't mean you're doing it wrong. It just means that something got your attention. When that happens, when it happens, which it will, I want you to notice that without judgment and just go, oh, yep, there it is. I had a thought or feeling, I'm distracted, I'm thinking about work, I'm thinking about whatever. Bring your attention gently, non-judgmentally, back to your phrase and your breath, okay? So I'm going to go ahead and pull up my timer and begin. Okay, go ahead and release that breath. If you've opened your, or closed your eyes, open your eyes. And before you do anything else, let's just take another moment. And I want you to check in with yourself again. Bottom up, from your feet up to your head. What sensations are you noticing in your body? What emotions are you having? What are your thoughts like right now? So just notice that. And I think what we'll do, because I have a lot of you in one place, is we'll take a moment for the moderators there, Courtney, I think, and maybe others, just get a couple of examples from the audience of how people are feeling. And then we'll put it in the chat section, and I'll come back to that towards the end and kind of wrap it up. But if just a few of you are willing to share what you're noticing right now, what you're sensing, feeling, and thinking after doing that exercise, let's go ahead and do that. I'll give you guys a minute to do that. Okay, while you guys are getting that and maybe starting to put a couple into the chat section, we just need 1 or 2 or 3, that's fine. I want to talk a little bit about what that exercise was. So it's called the relaxation response. This form of breath work is just all over the world throughout history. So it's certainly not the only way people do this kind of work, but its origins may be a little interesting to you. So it was created by a doctor named Herbert Benson. I think he originally started doing this in the 70s. Now, he was not a psychiatrist. He was just a regular medical doctor. And he was, I think, at Harvard studying the effect of stress on the body. We are very aware of that now, 50 years on, but at the time, it was still kind of a new area to be researching in. And he was interested in major diseases. So things like diabetes, high blood pressure, heart disease. And he wanted to see what the effects would be when he had his patients do this. So I think he would have them start at like 2 minutes. We did about 75 seconds. He would go to about, I think, 2 minutes, and then gradually have them build up to about 10 minutes, I think twice a day. And what he found is exactly what you would expect. When he would just have a client do it once, like sitting with him in an exam, their heart rate would slow down and their blood pressure would go down a little bit. And then, of course, in a few minutes, it would bounce right back up to wherever it had been. But if his clients practiced it over time, and again, I think it was like twice a day, 10 minutes a day, sometimes people would build up to longer, whatever, he started to see that those numbers would go down and stay down. And so they would start to see long-lasting improvement in hypertension and heart disease and diabetes and all that stuff. Pretty familiar to us now, okay? So why we're talking about that is that he noticed something that he did not expect. When he had his patients doing this, what they told him was not only did they start to see some of those numbers improve over time, but they said, when I'm stressed out, if I'm stuck in traffic or I'm in a stressful meeting or whatever, I can take a breath or two and say my phrase to myself in my head, and I can feel myself start to calm down a little bit. My heart rate starts to slow, my pulse starts to get a little slower, all of that, right? And that was not what he expected to find. But what he discovered kind of by accident is that when people practice this, right, and it's a regular thing, remember we said your brain gets good at whatever you ask it to do a lot of. The phrase helps trigger that thought for your brain, right? So if you have practiced with, let's say, let it be, and your body is used to what it feels like as it starts to slow down, and then you're in a staffing or you're dealing with a family member or an individual, and you can't go, hey, everybody, you people are stressing me out. So I'm going to go take a yoga class, maybe get a smoothie. I'll be back in 2 hours when I feel calmer. Nobody's got time for that, unfortunately. But if the relaxation response is something that resonates for you, and this is something that you do regularly, then your brain will recognize it. And when you take that breath or two, which nobody can see you doing, right? Nobody's going to notice. And you say that phrase to yourself a couple of times in your head, your brain goes, oh, I know what we're doing here. Okay. And you will start to slow down a little bit. And people always ask me, can you teach this to individuals? Absolutely. There are a lot of different things that we're working with in terms of breath and movement to help with regulation of individuals. So for sure. But right now we're just talking for us. And so if you are in a situation that is so agitating or triggering or stressful, especially if it's hard to gather yourself enough even to start the calmer skills with checking in, practicing something like the relaxation response, and the more you've done it, the more powerful it is. If you've only done it once, it may not do much for you. That's obvious. But if you've been doing this and you take that breath and you say that phrase to yourself, then your brain can go, oh, okay, I'm going to start slowing things down a little. And now maybe you've got a little bit of that room to start doing the check-in and the accept and the lovingly kind, right? And going through the CALMER skills, and then whatever problem solving you need to do. I always try to teach this to audiences. I taught this to my staff when I was a supervisor because it's so portable. It's not for everybody. If it didn't speak to you, that's totally fine. And there are other kind of similar things, but I teach this one because that hook with that phrase seems to be very useful and very portable. So I like giving you guys something very practical that you can actually use right away. Okay, so I'm going to go to the chat quickly just to kind of see what people said. No one felt comfortable sharing at this time. It's totally fine. Okay, so we are going to be wrapping this up. Here's something that any kind of practice that you are doing where you're checking in with yourself, especially if you're using that time to slow your body down a little bit, we know this is some of the benefit, whether we're talking about individuals or ourselves. It actually shrinks the amygdala, which is good, and it helps other areas of the brain connect to each other and talk to each other. Spend more time on that. But I think this is what I want to wrap up with, and then we'll pause for some questions and comments. When people talk to me about trauma work, we have a lot of things available for the general population to help with trauma. There are medications that we can use to help with the mood disorders that come with it, anxiety and depression. There are lots of forms of trauma therapy. There are all kinds of interventions and things. And hopefully some of your individuals that you've identified that do have trauma may have access to some of those things. And those things are going to be really helpful. But if you asked me to choose between all the meds and all the therapies and all the art therapy and horse therapy and blah, 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 and talk therapy and all that stuff, or you, for your individuals to heal from trauma, if that were my choice, I would choose you guys every time. And the reason for that is this beautiful quote from the late, great Irvin Yalom, a psychiatrist. It is the relationship that heals. And so when we reflect on everything we've been talking about today about the brain, that the brain reacts to its environment and it does more and more of what it's asked to do. When people are in environments that are frightening and threatening and isolating, that's what their brain learns, and that's what their brain does over and over and over and over and over. When they are in situations where they still experience those things, right? They still get scared, they still get angry, they still get agitated or hypo aroused, but now they're somewhere safe. And now they can do that in the context of a relationship with someone who is caring and present and helps them to put a different ending on those triggers or those experiences. That's what helps change brains towards healing. And I'm a trauma therapist, right? I love therapy. My dad's a pharmacist. I love drugs. All good. But the most powerful chance, the best chance that people have to heal is the lives and the environments that you help create for them, whether those are your direct interactions or you support those things as a supervisor or in leadership or helping family members to relate differently, whatever it is, you are their best chance. And so I'm so, so, so grateful to have this time with you guys that we're going to spend with you over the course of this project. And I'm really grateful for your attention today. So thank you guys so, so much. And I'm going to go ahead and stop the screen here and check the comment section for any other comments or questions. Again, as we've said, you will also have our contact information. I'll go ahead and put that slide up again at the end. And we're going to be around, so you can email us. You can talk with the organizers and they'll talk with us. And we will make sure to address anything that we didn't get time for in our short time together today. So I'm going to give that a second. If anybody has any comments or questions, we'll give Courtney a minute to get those up. I'm going to go ahead and bring the slides up one more time so I can put it on that slide for the contact information in case anybody wants to see that. go through these things. These are all the resources. And this is my email, or you can also email Kevin at Aldridge Pele, and we will be around. So you guys can find us. And let me check to see if we have any other comments or questions. And I don't believe that we do. I can't see it here for sure, but. Let's see. No, I think we are good. So thank you guys again so much. Let me see if there's anything else here. Nope, I think we're all right. So enjoy your Wednesday, everybody. Thank you so much for this time. I'm going to turn it over to Kevin, and he will wrap it up.